My name is Sandy Ruggles, and I was a Biodesign Fellow in the years 2009-2010. Prior to Biodesign, I was trained in biophysics, and so I have both an undergraduate and a graduate degree in biophysics, the PhD from UCSF. Following my degree at UCSF, I rolled some of the work that I've been doing as a student into a business plan with my PhD advisor and two other co-founders, and we started a company called Catalyst Biosciences. And I worked there for about 6 years following UCSF. So from the initial product concept to a business plan to fundraising with VCs, and finally into starting a company and growing that company up. I left there to do the Biodesign Fellowship because I had grown pretty frustrated with the cycle of innovation in biotechnology and really wanted to get to something that was much faster paced. I've always really been interested in innovation and in taking an idea, finding that idea, and then taking that idea forward and taking it all the way out to patients. And so a lot of what interests me and what drives me is that small team of people really focused on a problem and finding a core insight into that problem that they can use to develop novel technology. And so it's that process, that cycle that I really enjoy and that I'm always striving to look for in projects that I take on. From a strengths perspective, I had the experience of having written business plans, not only for Catalyst, but also for some ideas that we'd had in grad school. So multiple business plan contests in graduate school, and then taking an idea for a business forward into fundraising and all the way into starting a company. So I had that understanding of the process of raising money and of starting a company, but I didn't have any background at all in medtech. So I didn't know anything about design control. I didn't know anything about development and commercialization of medical products. For me, from an acceptance criteria perspective, what I'm looking for even now is something that I think really has an impact on healthcare, that really is driving easier decision making for patients and providers, and that really at the core has that insight that I was talking about, that funny little twist either on the technology or an understanding of the disease state that makes it something where you say, aha, that's so exciting. I chose to go to a large healthcare medical products company because my experiences prior had all been with very small startups and had all been very distant from the world of commercialization, of marketing, of business strategy. And I felt like I needed to work on that aspect of my ability to choose and push forward innovation. I think, to my mind, it has to be whatever it is that really resonates with you. I see people focus on disease areas because that's very important to them, either because of family or their own personal experiences with it. I see people focus on career goals, such as being an R&D engineer or being in intellectual property or marketing. But the ones I think that are able to span all of those really have some kind of core theme to their career path, and that's certainly something that I've tried to do, which is to keep innovation and insights at the core of what I'm doing, regardless of where I switch with regards to what my role is. I'm always looking for that next innovation or insight.